Hello everyone. In this video we're going to be talking about chronic bronchitis. So let's start. So the definition of chronic bronchitis is persistent cough with sputum production for at least 3 months in at least 2 consecutive years, and all of this in the absence of any other identifiable cause. This disease is associated with progressive lung dysfunction and can even lead to hypoxemia, pulmonary hypertension, or complications such as cor pulmonale. We will be discussing this further in the clinical feature section. Before that, we need to know the pathogenesis of this disease and how it is caused. So, a person who is exposed to irritating inhaled substances can develop this disease. And I'm sure all of you know that the most common substance is smoke. About 90% of the patients who have chronic bronchitis have a history of chronic smoking as well. That's why in the exam, if they give you a question regarding chronic bronchitis, they will almost always mention that the person has been smoking for years. So keep this point in mind. Next, few other less important substances are cotton and silica. So okay, you have inhaled these substances. Now what is exactly going to happen in your bronchi? So there will be mucus hypersecretion because the thickness and the number of mucus glands will increase. Smoking can also lead to dysfunction of the CFTR. The full form is cystic fibrosis transmembrane conductance regulator, and this dysfunction can cause secretion of abnormal dehydrated mucus, meaning it will be very viscous. Also, of course, there will be inflammation where neutrophils, lymphocytes, and macrophages get involved. Okay, now all of this has happened. What will the bronchi look like now because of these effects? So there will be hyperemia, swelling, and edema of the mucous membranes. And because there is mucus hypersecretion, the bronchi and bronchioles are filled with pus. And there will also be an increase in Reed index. So now what exactly is Reed index? Let's see. So Reed index is a ratio of the thickness of the mucous glandular tissue and the distance from epithelium to the cartilage. I will show you a few images and it will become more clear. Normally, the Reed index is about 0.4, but it increases in chronic bronchitis. Let's see why. So this is a microscopic picture of the bronchus where this arrow in green represents a distance from the epithelium till the cartilage. And this arrow in blue represents the length or the thickness of the mucous glandular tissue. Now what is Reed index? So Reed index is the ratio of the mucous glandular part, which is in blue. Let's call this part A, and the total thickness till the cartilage in green. So let's call this part B. So we just saw that normally the ratio of A and B is 0.4. Now let's see what happens in chronic bronchitis. So this is another microscopic picture, but right off the bat you will be able to notice something different. The total thickness will remain more or less the same, but the thickness of the glandular part has increased a lot. So now we can say that in chronic bronchitis, if we take the ratio of A and B, the ratio will be more than 0.4 because the numerator here, which is A, has increased. So in conclusion, Reed index basically tells us about the thickness of the mucous glandular part in comparison to the total thickness till the cartilage. Okay, now what else can we see in this condition? So there will be hypertrophy of smooth muscles in the bronchial wall. There will also be deposition of extracellular matrix, and there will be goblet cell hyperplasia, which again will lead to mucus hypersecretion. And if this condition goes on for a long period of time, the lumen will become obliterated due to fibrosis. Now, what are the clinical features of this disease? There will be chronic productive cough because of mucus hypersecretion. Now, of course, if there is any obstruction in the respiratory pathway, like due to a mucus plug, there will not be proper exchange of gases. So these patients will also have hypercapnia and also hypoxemia. This hypoxemia can lead to cyanosis, which gives a bluish discoloration, which is why these patients are also called as blue bloaters. Now, these patients may also have fever, and if the person is too addicted and still keeps on smoking, it can even lead to squamous metaplasia, which can finally lead to cancer. And another complication which can be caused is cor pulmonale. Now, how are you going to treat this condition? So, of course, it goes without saying, first of all, stop smoking. Then, we can also give oxygen therapy to the patient because he has hypoxemia. We can give bronchodilators because the lumen of the bronchioles may be obliterated. We can give inhaled corticosteroids. And in case of infections, we can also give antibiotics as well. So the last part of the video, in the questions you have to look out for productive cough since months, mention of the patient being a chronic smoker, very important, and an increase in read index. All of these are going to point you towards chronic bronchitis. So that's it for this video. If you have any doubts, so please leave them in the comments, or you can message me on Instagram anytime. I will be leaving the link to my Instagram in the description. Thank you.